Our case study's title is Medication Approval by Sarah, Alexandra, Sophia, and Ray.
In this presentation, we'll be talking about our motivation and the relevance of this case study. We will also be discussing the background research, the project design plan, and the limitations we found. It will also include patients' testimonies and finally a reflection of the case study results. Medication approval is one of the biggest healthcare challenges for patients, and it is due to two factors. The first factor is they need to even understand how prescription drug coverage work. They need to choose the right insurance for them to ensure that their needed medications are covered and affordable. Patients use a formulary, which is a list of covered drugs organized into tiers, to determine the correct plan. Each tier defines out-of-pocket cost based on drug types, price, and effectiveness. In this presentation, Tier 1, Tier 2, and Tier 3 and Tier 4 are examples of how people can get their coverage in a day-to-day situation. The challenge that lies about medication approval is prior authorization process. Prior authorization process is where insurers require approval before covering certain medications, tests, or procedures. PA creates challenges for patients and doctors, including having to plan treatment and predict what insurers will approve often without clear guidance, unclear and inconsistent approval criteria that vary by insurer or reviewer, treatment delays, medication abandonment, and disrupted care if reauthorization is denied.
Problem flowchart. To better understand where in the approval process for insurance companies medicine can be denied, we create a flowchart. Starting off, the doctor diagnoses patient with a medicine sustainable condition. This means that the patient is fine, but they require medicine through their daily life. The doctor then prescribes the medicine based on the patient's needs, allergies, and medical histories. This is important due to many medicines being on the market. The prescription is then sent to the pharmacy either electronically or via paper. The pharmacy submits a claim to the insurance company for a coverage check. This is where the first decision applies. The insurance company can either decide the medicine requires prior authorization or not. If the medicine does not require prior authorization, it immediately is approved by the insurance company and the medication is able to be picked up at the pharmacy. If the prior authorization is necessary, the doctor must submit a prior authorization form and a medical justification. This is to prove to the insurance company that the medicine is required and not cosmetic or unnecessary. The insurance reviews the request and documentation to determine if the medicine is necessary, which leads us to our second choice. Determine if the PA is approved, denied, or further clarification is needed. If the medication is approved, it loops back to the end result, which is the insurance approves of medicine to the pharmacy. If it is denied, it loops back to the insurance reviews and requests documentation part. And if more information is needed, it loops back to the doctor submitting another PA form and a medical justification. Through this, we see two different choices as well as three different results coming from one choice. At this point, we believe that the problem is likely at the last choice of determining if the prior authorization is approved, denied, or if clarification is needed.
We designed our project by selecting each member their position and roles based on their own strength. Here you can see the list of the members and their roles. The interview selection was done by patients within the healthcare community that wish to share their feedback that has had to pay out of pocket or has had their medication denied with them having insurance. The three interviewees were selected due to their differing background and accessibility to their insurance. The interview was either a one-on-one phone call or face-to-face interview with just the interviewer and the interviewee.
Limitations. In our case study, we had two testimonial issues, the first of which was the healthcare testimony that fell through. Gonzalez's contact within the healthcare community was unable to meet for an interview to give her statement as to what insurance process looks like through the healthcare side. This would have been greatly beneficial as the interviewee's entire position is being on the phone with insurance companies to provide that PA. The next testimonial issue was the patient interviewed by Mitchell. At the time of the first interview, they did not go into depth of their experience. To reach a better understanding of the effects of the insurance approval process, Mitchell re-interviewed them and we gained a better understanding of what their experience was.
Our first interviewee ended up having a pretty good experience with her insurance provider. She has Blue Cross Blue Shield, which is generally known as a good insurance company. She was looking for coverage for SSRIs and other medications which contain controlled substances like amphetamine compounds. And her request for insurance was approved very quickly, although she did have an out-of-pocket cost of $750 a month, which is pretty low as far as some copays go. And she got that approval for the insurance on her first try. Although she was referred for the generic form of the medication, she ended up going with the slightly more expensive name brand medication. While it was very successful, she does have to go in once a year to take drug tests. They just test to ensure that you're actually taking the medication and not selling it. And then she also has to attend monthly visits with her psychiatrist, who will give the referral to the insurance company. And one last thing I forgot to mention, she did have to get a referral from her physician. Our second interviewee also had a pretty positive experience with her insurance company, which was also Blue Cross Blue Shield, or also known as Anthem, and this happens to be in Kentucky. So the interviewee was looking for insurance coverage for the blood pressure medication that she takes. She was able to get approved with coverage for the first time. She did have to get a referral after doing blood workup and standard tests. Just send that over to the insurance and make sure that she actually needed the medication. There is an out-of-pocket cost of $25 for a 90-day prescription, which is also very low as far as most copays go. And the medication that the interviewee is currently taking is generic. Our third interviewee did receive insurance coverage, but it took a very long time to receive that. To start off, she had private insurance under Medical Mutual. She was seeking coverage for a medication called Dupixent, which is a pretty expensive medication. Without coverage, it runs anywhere from $3,000 to $3,500, and that's just for one injectable dose. It is an injectable medication, and it has to be injected by the physician first so that the patient can learn how to use it. The first time she went seeking coverage for that medication, she was quoted $840 for the first dose, which for most people is pretty unacceptable. She also had to contact multiple people after she got that first quote because she was told it would be fully covered, and then they did not. But she called back saying, they had told her that she was supposed to get full coverage. And after a couple days and a couple hours, she did finally get that insurance coverage that she was looking for, and it seems to be going well since then.
This case study examines the challenges faced by patients when insurance policies and coverage limitations restrict access to essential medications. Our subjects of the study, a middle-aged and 2 younger adult women, repeatedly encountered delays and denials when attempting to get their medications. Despite having medical documentation when supporting the necessity of the medication, their insurance providers made it difficult for them to obtain their necessary medications. Specifically, all 3 women had difficulties with authorization delays, cost barriers, and difficulties communicating with insurance companies. While all 3 women eventually obtained their medication, they had to go through a longer process communicating with their insurance companies. The women also had different levels of insurance, even with one of them having a high insurance policy. They still had to go through the trouble of getting coverage for her necessary medication. All 3 patients we had in our study were lucky enough to obtain insurance coverage for their medications, but the process of getting it was difficult. Our original goal was to understand patients getting their insurance coverage denied and why, but after we concluded that most people can get coverage, it is just a long and tedious process of eventually getting it. The repeated delays, denials, and financial obstacles not only disrupted our patients' care, but also contributed to the unnecessary physical and emotional suffering. Our study revealed that the current insurance system often prioritizes cost containment over the patient's well-being, forcing the individuals to navigate the complex administrative processes for medications that were deemed necessary by their physicians.
Thank you guys for listening to this presentation. And here are the sources.